Hi and welcome back to 90 Day Dental Day 39. So, final section of perio coming up. We're on the final home stretch with perio, and we're talking about oral hygiene products and getting an update for all the various things that exist out there and what some of the updates and then some of the newer things that are coming out are. And no better person to do this with than Kat Edney. Take it away.
Hello, I'm Kat Edney, dental hygienist and therapist, and together we're going to explore the what, the how and the what now of oral hygiene aids in periodontal treatment. I've been treating periodontal disease in specialist practice for over 10 years, and I want to share with you my go-to products for improving home care, strategies for affecting changing your patients' routines, and the latest developments in oral hygiene products and sustainability. I've been working in the heart of London's financial district for over 10 years, and due to also being situated in one of the poorest boroughs in London, I've seen an extensive range of patients through my surgery door. Being lucky enough to work with top-class periodontists has given me the opportunity to really refine my methods when it comes to effectively treating periodontal disease. Overcoming the hurdle that is patient home care is the cornerstone to good periodontal treatment. So here is my what, how, and what now of oral hygiene aids. There are so many innovative and wonderful products on the market, and finding what works for your patients can be overwhelming. My personal goal is to make excellent oral hygiene as simple, cost-effective, and easy as possible for my clients. And with that in mind, I'm a big fan of the big three: oscillating, rotating, electric toothbrushes, interdental brushes, and single tuft or interspaced tuft brushes. There is no doubt that there is compelling evidence for Oral-B electric toothbrushes, but the main reason I reach for it for most of my patients is that I have access to the test drive unit, which has revolutionized how I deliver oral hygiene instruction. Being able to physically demonstrate pressure, location, direction of toothbrushing gives patients that eureka moment that is often the realization they needed to recognize where they've been going wrong.
So usually in surgery, when I decide I'm going to use the test drive, I will ask the patient to first demonstrate to me what they have been doing with their brush, if they're already using an Oral-B. This is a really good way of me understanding why they may have been leaving some plaque behind, and you might be surprised with the kind of techniques that people have been using in the past. Then when I grab the brush, I explain that I work slowly and systematically from one side to the next, giving each tooth its individual attention and making sure my bristles are angled 45 degrees to the gum line. I like to make sure they're watching in the mirror and that they can see those bristles splaying between the teeth, and I explain that they are getting those little tiny spaces that if they skip over the teeth, they would be missing. This is the eureka moment I'm talking about.
The use of interdental brushes is gold standard home care for periodontal disease, and whether you reach for TP, Stoddard or Vision Perio, the most important aspect for me is that patients feel the pressure of a snugly fitting brush. All too often I come across patients who are using brushes that just don't touch the sides. The larger end of the interdental brush scale may look intimidating, but the bristles need to retract and compress on the inflamed gingiva in order to effect change.
My aim with the TP brushes is to get the snuggest fit possible. At the back, I tend to bend it at a right angle to give better access. And then what we're doing is just trying to sneak that in above the contact point, squeezing the inflamed gingiva out of the way. And we're looking for this slight resistance when we're using it, and that gives me a good idea it's tight fitting. Some people find the buckles of the upper teeth difficult to access because of the cheeks, and a little handy tip is to try and access those areas from the palatal. So again, I've bent the TP brush right at the base of the metal part, and then I'm able to sneak that with a little pressure over the contact points.
The old school, tried and tested single tufted brush, when used correctly, is an asset to any oral hygiene routine. This little brush gets into all the key vulnerable points like vertical defects, furcations, and even the distals of those 8s.
So I like to use longer bristle, medium texture bristle, single tufted brushes for furcations. Here I am trying to splay the bristles onto the tooth surface first and then just sneak them up into that furcation area. The idea is to be gentle but with deliberate pressure, and therefore you're going to disturb the biofilm that's living up within that pocket area. When I'm using a single tufted brush to clean difficult to access areas rather than into pockets, I like to use slightly stubbier, shorter bristles. They're a little firmer for removing that plaque, and we can angle them in loads of different places. They're really great for just sweeping out that little area that the toothbrush sometimes misses, also for those impacted 8s or around those opercular areas. So this is one of my favourite brushes to add to anyone's routine.
The addition of vertical pocket biofilm disruption with a single tuft brush is a game-changing move in any periodontal case. But how? How do we affect this change in a patient's routine? It's all very well having the tools and the talk, but do patients really ever change? For me, I think the answer is to helping my patients is not to ask them to change. I put a huge emphasis on understanding who my patients are as people. I'm interested in their home lives, their work, their daily routines. I care about the external pressures and stress factors that they might have. All of this information I glean from conversations with them during consultation, so that when I am educating them on their oral condition and suggesting ways they can improve their health, I'm linking my suggestions in with their own circumstances, such as to TP while the kids are in the bath or after their morning gym session. I'm often found explaining that I floss in the shower, it's my only time alone. I get cab drivers, night shift workers, new parents. Our lives are no longer always as simple as day and night, and I found that tailoring my suggestions to fit in with their individual's current routines gets me the results we want every time. So what now? I see a bright and bold future in oral hygiene aids. The scale of improvement ranges from the amazing new AI technology coming from Oral-B right over to important changes in sustainability.
Oral-B have added micro vibrations to their oscillating rotating brush head, in addition to some pretty special upgrades to their new handle.
TP have been working tirelessly developing their good range, which is handles made of sugarcane. Sugarcane is a much more eco-friendly and sustainable natural material to use due to the reduced amount of water used in production and also the minimal wastage of sugarcane crops. They're fully recyclable too, which means you can just chop off the head and toss it in the recycling when you're done.
The production methods used for TP Good mean a super low carbon footprint for all of the handles used in the TP Good range.
Bamboo alternatives have been around for some while now. The range is extensive. Take a look at Pixters, bamboo brushes from the Humble company, who also stock loads of other floss picks made of bamboo, even cocoa floss. And if you, like me, feel a huge responsibility towards our patients and our planet in reducing our plastic waste, then now is the perfect time to start looking at stocking some products which are responsibly sourced, produced and packaged. Most importantly, involving your patient in your selection process and educating them in the reasons behind your choices can only lead them to being better informed and therefore more likely to see the importance in a tailored and specific approach to their personal home care. I'm Kat Edney. Thank you for listening.
A very useful reminder of all the things that are available out there. Please continue to like and share on our YouTube and Instagram pages and comment below just to give us the extra support that we need. Tomorrow we've got a bonus feature that we're adding on and tagging on to this final section before we move on to something next. See you then.